My name is David Gitlitz, and I am a vascular surgeon, and I am an associate professor of surgery at the University of Maryland School of Medicine. I trained at medical school at New York University School of Medicine in Manhattan. After that, I did my residency in general surgery at Montefiore Einstein, which is composed of multiple hospitals. So that was a 5-year residency in general surgery, and then following that, I chose to subspecialize in vascular surgery. I did my vascular surgery fellowship training at Mount Sinai in Manhattan. So I've been in practice for almost 2 decades between New York and Maryland, and starting in the fall of 2018, I came down to the University of Maryland and started practice here at Midtown campus. Probably the most common conditions are related to blockages or disease in the blood vessels. One of my special areas of interest is blockages in the arteries of the legs, also called the lower extremities. That can cause a variety of ailments and complaints, anything from difficulty in walking more than a few hundred yards. A lot of our patients have difficulty walking more than a dozen yards, to patients whose legs or limbs are at a risk for loss due to a non-healing ulcer, infection, gangrene, that sort of a thing. So my job is to try to fix that circulation, either from inside the blood vessel using a technique that we call endovascular surgery, which is basically a complicated word for fixing the blood vessel from inside using a variety of techniques, balloons, stents, that sort of thing, or to do an open procedure, meaning a bypass, where we take a patient's vein that is not essential for their function, and use it to bypass a blocked portion of the artery and deliver blood flow further downstream beyond the blockage so that the patient can heal, can be pain-free, and can go on to recover and get back to their normal life. I really like challenging problems. Most of the patients that present with vascular disease have a number of medical comorbidities. They usually have heart disease, they usually have diabetes, they smoke, high cholesterol, and they can be very fearful because they've probably been told by their doctors that they can't safely have an operation. And I find a lot of satisfaction in being able to comfort them and sort of shepherd them through the process and explain to them, this is what we do. And we have dozens and hundreds of patients just like you who undergo these procedures every day. And I find it very personally gratifying to be able to reassure them and give them some hope for relief. Every patient that comes through the door, we regard as an individual. Although we do have certain algorithms and treatment plans that are drawn up to standardize care and to make things as safe as possible, each patient is looked at as an individual, and their problems may differ a little bit and require a different approach. And so we individualize the care according to each person.